Good morning, everyone. My name is Jill Butty, as you've just heard. I'm the Director of Women's Health and Population Wellbeing with the Department of Health. Similarly to my earlier colleagues, I'd like to acknowledge the Aboriginal people who have been traditional custodians of this land, the Yorta people. Normally when I'm at home, I'm on the lands of the Bunurong people, and pay my respects to elders past and present, and to anybody in the room today or who can hear who is of Aboriginal or Torres Strait Islander descent. But I'd also like to pay my respects to everybody in the room, and thank you so much for coming along. We at the department are really excited to be part of this conference. As you may or may not know, the department also sponsors 20 sexual and reproductive healthcare hubs. And when we have meetings with them, we are told constantly what a fantastic conference this is. We've had, nurse practitioners from those hubs tell us what great connections they've made here, the networking that happens, as well as all the interesting work that's presented. So we're really thrilled to be part of this today. And I can see my team looking at me going, "You've gone off script already, Jill. We haven't even started." Okay, so it's really an amazing time in women's health at the moment, as you're probably aware. So the progress that's been made in recent years, something few would have imagined if even a decade ago. So the WHO defines sexual health as a state of physical, emotional, mental and social well-being related to sexuality. Sexual health requires a positive and respectful approach to ensure all of our women, girls and gender diverse people are safe, free of coercion, discrimination and violence, and able to exercise their bodily autonomy and have choice. The Victorian Sexual and Reproductive Health and Viral Hepatitis Strategy for 2022 to 30 outlines our aspirations to achieve the best possible sexual and reproductive health outcomes and reduce the impact of bloodborne viruses and sexually transmissible infections for all Victorians. Over 500 people from across Victoria took part in consultations to develop that strategy. In 2023, we released the Listening to Women's report, which emphasised the challenges faced by over 1,700 Victorian women and girls with accessing quality healthcare and timely services close to home, many of whom resided in regional and rural Victoria. In 2024, we had the inquiry into the inquiry into pain, and we heard from over 13,000 women, girls, gender diverse people, carers, health professionals and peak bodies about women's experiences of pain and pain care. There were 41 focus groups that were held in the community. Over 300 written submissions were received, and the response was overwhelming. We asked, and women told us loud and clear that we need to do better. They told us that, and by the way, this is not quite released yet, so this is like special. Our healthcare system needs to be simpler to navigate and access, especially for women and girls residing in regional Victoria, to reduce unnecessary red tape, high costs and waiting time. That was loud and clear. The evidence-based information should be readily available for both community and clinicians on women's health conditions and treatment pathways. Our healthcare professionals need to have better knowledge and skills when it comes to women's healthcare to better diagnose and treat pain conditions. Our healthcare professionals also need to engage more deeply with women and treat them as a partner in care so that women are heard, feel safe and respected, especially when it comes to sexual and reproductive health matters. The understanding and tailored treatment for priority cohorts is needed, including women living in regional and rural Victoria, First Nations women, cold women, LGBTQIA+ people, communities and women living with a disability. We need to invest and prioritise women's health research to have evidence-based treatment options. And as a community, we need to better understand the living and lived experiences of pain and its short and long-term impacts. All of this is going to be released very shortly in a report that will be coming to an internet site near you. The momentum we have had at this point in time, particularly in Victoria, is something I believe we must embrace and use as a burning platform to pave the future we want to see for our women and girls. So the Women's Health Vision. A woman's health is a woman's right. The Victorian Government's fully committed to working with the sector and with communities to ensure women have access to the reproductive health care they choose. That's why we're investing in our Women's Health and Wellbeing program. We know that when we invest in women's health, we're investing in the health of our communities, families and society as a whole. So in May 2023, there was a commitment of $153.9 million to improve health outcomes for girls and women across the state. As part of this commitment, we're creating an integrated women's health service system and investing in women's health beyond bikini medicine. So we're rolling out a women-centred approach with wraparound supports and services ranging from health information and advice, health prevention and promotion activities, all the way to services provided within primary care settings and tertiary settings. This requires strong collaboration and the effective integration of the service system between all levels of government. And almost all of you in the room are involved in that system in one way or another. We know women and girls in rural and regional Victoria face additional barriers to accessing healthcare services, and that's why many of our initiatives have a particular focus on addressing the needs of those living in rural and regional areas. With the clinics, as part of the program, we've already established 5 clinics, multidisciplinary women's clinics in hospitals, removing the barriers women face when trying to access specialist care for surgical abortion, endometriosis, pelvic pain, polycystic ovary syndrome, heavy bleeding, incontinence and prolapse, perimenopause and menopause. It says 5. Actually, there's 9 operating at the moment and we're just waiting on the 10th. But anyway, these clinics will be delivering more services closer to home, with another 5 clinics opening in the first half of this year, 4 of which are open, and the next 5 clinics opening in the second half of 2025, and the next 5 are all based in regional Victoria, bringing these important services to rural and regional women and girls. To date, thousands of women have started to access these services, and we can already see it's making a big difference in places that women's health specialist services didn't exist previously. So currently, I think up to the end of March, we'd had over 3,000 women access the clinics. Again, not published, don't quote that. The Mobile Women's Health Clinic, and I can see Louise Holland here, and our other support from Breast Screen Victoria. So the department's partnered with Breast Screen Victoria to deliver the mobile outreach service for women's health for girls, women and gender diverse people residing in regional and rural Victoria. So services are being delivered on an existing Breast Screen Victoria van called Nina, and this has been purposefully refurbished to travel to remote and regional Victoria and provide sexual and reproductive health services closer to home, including contraception, some sexual health testing and treatment, medical termination where possible, and referral for surgical termination and other local health services. The links with the local health services, including Aboriginal community controlled health organisations, local communities and schools that the Breast Screen Victoria are establishing, are incredibly important. And the work that's happening in that van, I'm sure some of you can talk later to this, but has been really important and really interesting to hear. The Virtual Women's Clinic commenced its operation last week on the 2nd of June, and it's run by each community services. So the clinic's providing a statewide telehealth service that's available online or over the phone, and gradually will increase to a 5-day-a-week service. It's offering free expert medical advice, treatment and care for a range of women's health needs, making it easier for Victorian girls and women to access services for treatment for endometriosis, pelvic pain care, menstrual health, cervical screening, menopause care, as well as contraception and medical abortion. So this initiative will assist with addressing many of the barriers which restrict girls, women and gender diverse people from accessing healthcare due to geography, cost, their caring responsibilities, cultural stigma and shame. So you can ring from anywhere in Victoria. We're also excited by the launch of the Aboriginal Women's Health Clinic, the first of its kind in Victoria, which will be delivered by First Peoples Health and Wellbeing from mid-2025. So the clinic will provide a range of services, including screening, diagnosis and management of women's health conditions, including pelvic pain, endometriosis, menopause, long-acting reversible contraception and termination of pregnancy. The staff will play a key role in service navigation for patients, streamlining access to timely and culturally safe diagnostic and treatment services across the healthcare system. The clinic will also help to address the ongoing health equity and outcomes by increasing patients' understanding of their own bodies, fostering self-determination in health and wellbeing, and promoting women's health literacy. As many of you who are here today will be aware, we now have 20 sexual and reproductive health hubs, including 12 in regional Victoria, providing free or low-cost sexual and reproductive health to those most in need in the community. Over 8,200 women have visited the hub services for 24-25 financial year, many of whom are concession card holders. So these services were designed to strengthen the system so that women, girls and gender diverse people can have access to patient-centred health services that are available, acceptable, appropriate and affordable. We're delivering services that meet the needs of all women by providing safe, effective care grounded in equity that is evidence-based and strengthening the workforce skills and capability to support this model. And again, many thanks to all of you in the room who are participating in those sexual and reproductive health hubs, because you're the people who make the magic happen. We also fund 12 women's health promotion organisations. These organisations have a focus on promoting gender equity in healthcare, women's health chronic disease prevention, and improving sexual and reproductive health outcomes for girls, women and gender diverse people in Victoria. In addition, their work also focuses on health promotion, primary prevention, driving improved mental health outcomes and family violence prevention. And of course, as I've mentioned, our amazing workforce. So the workforce supporting the hubs and clinics, the nurses, nurse practitioners, midwives, endorsed midwives, GPs and allied health professionals are also benefiting from the Women's Health Scholarship Program. This is helping to improve skills and knowledge when it comes to women's health. Over the past 2 years, over 350 scholarships have been allocated to the Victorian workforce to build capacity in women's health conditions. Many of the scholarships included training in IUD insertion and removal, sexual and reproductive health, pelvic physio training, menopause care, PCOS management. And the scholarships are also funding training to promote cultural safety and remove existing barriers for First Nations women, women from migrant and refugee backgrounds, and LGBTQIA+ communities. This important initiative is supporting our frontline staff to continue building women's health expertise across hubs and clinics. I'm nearly finished. I'm taking Fred's words to heart. You probably just want to get into the guts of this, and I'm still going. Research initiatives. We're also working on Women's Health Research Initiative, including a business case for the development of the Women's Health Research Initiative and Women's Health Research Catalyst grants. We know that women's health research has for so long been siloed, and it's vital that a response to this gap must be across the whole sector. We also have 13 community support groups for women across Victoria, including Gippsland, North Geelong, Wangaratta, Ballarat and Mildura. The groups vary in their focus, with some providing support around building health literacy and community connections, reducing intergenerational trauma and isolation, and promoting health and wellbeing, while others provide support around specific women's health concerns such as menopause and abortion care. Groups have been established also, especially for First Nation women and girls, as well as for migrant and refugee women. I know many of you who are here today were able to join us back in April for the landmark Symposium on Abortion event, and I can see lots of people in the audience today who were there. And we brought together leaders, health professionals, researchers, peak bodies and consumers to explore practical ways to improve abortion across the state. There's a lot of hope and promise for the ongoing work we're doing across women's health, in particular the work of the Women's Sexual and Reproductive Health Hubs in regional Victoria, ensuring that women and girls have greater access to services and care that they need. In the words of Dr. Jo Wayner, a long-time advocate for women's rights, who spoke at the event, the abortion event, on her own work in abortion decriminalisation and reform, eternal vigilance is the price of liberty. It was really a sobering reminder that we all must remain vigilant, continuing to protect and embed all the significant gains we've made to ensure future generations of women and girls are afforded the same rights. Following the symposium, the department's developing a work plan for the Access to Life and Top subcommittee under the Women's Health Advisory Council to implement and ensure greater access and improved delivery of abortion care services. I'm on the last paragraph. I hold so much hope and promise for the ongoing work we're all doing across women's health. While we're moving towards a much more integrated, inclusive and accessible service for all, there's still a lot to do. The amazing reforms that are happening across women's health will help shape the way that healthcare is delivered in our state for generations to come, and will transform the system not only for girls and women, but for everyone. In particular, the work being done in regional Victoria is making such an enormous impact to women and girls living in regional communities. I think we can agree that the services are going above and beyond, and we've heard lots of stories from our sexual and reproductive health hubs of particular clinicians really going above and beyond, and trying to ensure that all women and girls have greater access to the services and care that they need. Thank you very much.